With BMTV, the future's bright and strong.
Welcome to another program on BMTV Nsukka. Okay, today we are going to be talking about a very interesting topic that has to do with human health, human well-being. And that topic is about kidney failure. When you talk about kidney, we know that the kidneys are small organs in the body, but they work 24 hours. They work 247. They're always working. And then when there is a failure in their function in the body, it becomes a problem. It becomes life-threatening. And it has causes. There are causes of kidney failures, and there are effects that they cause. As a result of having kidney failure, what are the effects that you have to pass through, all the things you have to go through in life because you have a failed kidney? Then, what is the hope for someone that has kidney failure? All those things are what we are going to talk about today. And that is why we have this important guest today with us, who is by name Dr. Oliver Onyeishi. Dr. Oliver is the MD Kainte Hospital that is located along Urban Girls Road in Nsukka. He is also the CEO of Beke Pharmacy. So, as you can see, he's someone who is a medical practitioner, and he knows well. He knows well about all this we are going to talk about today. Please stay glued to your phone and listen to what we are going to talk about today. You're welcome, sir.
Thank
Welcome,
you.
Welcome,
Doc.
Doc.
Thank
Doc,
you.
you're welcome, sir.
Thank you for having me.
All right. So, Doc, having said little things about this topic, we would now like you to, briefly explain to the viewers what actually kidney failure is all about. Because our topic today is understanding kidney failure, the causes, the effects, and the hope for someone that is a patient. So please tell us more about kidney failure.
Okay, thank you very much.
Thank you, sir.
First and foremost is to interest you to know what this kidney is and where it's located in our body and what it serves in the body. Kidney, there are two organs bean shaped located at the lumbar region of the abdomen.
Okay.
And the function of this kidney is to eliminate waste products from the blood. That means all the waste, just there is like an S-warmer of the body that carries all the waste produced in an area to
Okay.
deposit them where they are needed. That is what the kidney does in the body. They will eliminate all the waste products in the body and you now urinate it out in the form of urine.
Okay.
So you can see the importance of this particular organ. And
Yeah.
how do we know organs that are very, very essential? God made every organ that is essential in the body, you always make it two, so that there will be spare in case of
Necessity or
one
some
crashing
parts.
down, as we are going to discuss.
Okay.
Yes, there are a lot of things that could lead to failure of this organ, which ranges from disease conditions. Disease commonly around Africa is disease conditions like high blood pressure, diabetes, herbal medication, and other habits.
Okay.
Habits.
Okay, Doc. Okay.
These are basically what there are many others like drugs.
Yeah.
But these are the commonest you have around.
Okay,
Yeah.
don't worry. We are here today. We are still going to further into the causes. All right. So please, Doc, as a medical practitioner you are versatile. And I believe that you might have heard one or two things. You might have handled patients that have kidney failure. So is there any story related to your profession concerning kidney failure that you might like to share with us and the viewers?
Yes, kidney failure is now becoming, say, rampant. And with the media, it has also been made very common in the society. You see them in the media, people soliciting for help to handle their kidney issues. So it's quite common. I've handled a lot of them, ranging from the acute kidney injury to chronic kidney injury. They are not the same.
Okay.
And so a lot of them, people.
Okay. All right. So now let's go into the causes. What are actually the causes of this kidney failure?
Well, like I've always mentioned,
Yeah, you mentioned a
know,
few before.
diabetes, high blood pressure, kidney infections, and certain drugs, over-the-counter drugs like painkillers and herbal medications. So these are the commonest around here, in addition to what I said, habit, people's habit. Habit in the sense that, see, the moment I walked in, people were clever enough to serve me with water. This is one of the best thing anybody can serve you. It is the first line drug for the kidney.
Okay.
But as common as it is, many people
Do not know.
don't take water. So it hydrates the kidney, helping it to transport those waste to outside. So these are the commonest around.
Okay. So what are the symptoms? What are the symptoms that comes with kidney failure?
Wow. The symptoms, basically, the one that is usually obvious, that when you now look at it, you say, yes, this person seems he has kidney problem. The first thing you notice is that the legs, the two of the ankles will start retaining fluid. That is leg swelling.
Okay.
Even though there are other conditions like heart failure that could mimic such, but in the case of kidney failure, you see the person's two ankles will start swelling up. Person may start becoming weak. Person may start becoming nauseatic, vomiting, and feeling of confusion, because once these wastes are not eliminated properly, some of them may go back to the brain and start causing such dizziness, fatigue, and other. Why is there leg swelling? Because the kidney can no longer excrete all the fluid in the body.
Yeah.
Then the person will start retaining. So other symptoms, you notice that the person cannot make urine as supposed to do. So these are the commonest symptoms.
Okay.
Dr. Onyeishi, you're welcome, sir.
Yeah.
Ndị Igbo kwuru okwu si na mgbochi ọrịa ka ọgwụgwọ, ma azọta ndụ na-ewu dosie n'ọnụ, anyị na-amaghọ na anyị ya anwụ n'ọkụ anyị nọzitakwa ma. So my question is this: what are the physical, emotional, and the financial effects of living with kidney failure? Maka ọtụtụ n'ime anyị kwetere temu na onwe m na onye niile eshi ya ruo ohe na kidney na ọghara mgbada.
No worry, and Diego.
Ọ ga-abụ laba na ndị ọkwa bụ the next thing. So nsị ka m jụma mee how ka esi feel?
Yeah, like you said, that is how every other person feel. Once you are down with kidney problem, emotionally, even some of them are vulnerable to drugs. But once you hear that you have kidney problem, the person is already down, and because even if it is curable, what of the financial aspect?
Yes.
And around our area, people don't usually treat their problem early enough. So most of the kidney failures you see around has already become chronic, that may be requiring dialysis. It is not a good experience anybody would want to have, going through dialysis, and it requires frequent medical checkup, and it requires a lot of finance, and that's why you see people will always go to media for assistance, sourcing money from every person, and God forbid if it ends up in renal replacement, getting a donor and the cost of fixing it, and it's not easy. I think borrow from what happened to one of the politicians in the town. Imagine when if such illness could drag such person around, how much more when it happened to
common man.
I and you. So it's not a good experience anybody will want to have. So that's why it's good to look at this disease and see a way we can stop it from coming. That's just the best approach. Preventing it. That's the easiest way to handle the condition.
Okay. Hey, Doc.
Okay, I'm not going to show you a can of
Sure.
Man, I know dialysis. What is dialysis and how does it work?
Okay. Yeah. Good question. Dialysis is simply a machine was designed. Dialysis machine is artificial kidney designed to do those works that kidney could not do. So they will connect your blood circulation to the machine that will filter those wastes that have accumulated because of the failure of your kidney. Your kidney could not do the normal work it used to do. So those waste products are now accumulated in the blood system. So what the dialysis machine do is it will now do that work. Your entire circulation will pass through that machine. It will now filter those wastes. And
does that make it a periodic exercise?
Sure, because the kidney works continuously.
Yes, and
So
there will be accumulation.
anytime, because your body keep working and waste keep on generating waste, the one they filter is just momentarily.
Okay.
Yes, and that's why they kept on going, depending on the severity. Could be weekly, could be 2 weekly, could be monthly. So it depends on the level of the failure. So that will determine how frequent the dialysis machine will roll over the blood system to eliminate the waste.
Okay, thank you very much. My question is this. When an illness comes, I believe that there are some do's and don'ts.
Yeah.
And in those do's and don'ts, one has to look into diets, the things you will consume, because definitely what we consume contributes to the causes of some of the illnesses that we go through. My question is, how does diet contribute in improving the health of a person suffering from kidney failure, or weakening or reducing the health of the person suffering from kidney failure? Well, let's go with improving first.
Yeah, they said human being is a product of what you consume.
Yes.
Yeah, so like I said earlier, the best diet for kidney is water.
Okay.
That's the best diet kidney consumes. So it's very, very important that you hydrate your system, because it's just like a swimmer car that doesn't have fuel.
Yes.
So even though it has loaded its waste, but it cannot move to deposit them because there is no fuel in that.
To act as a conveyor.
So the water is the conveyor of that waste. For this waste we are talking about, they are tiny micronutrients. Do you understand that the water, pushes out of the system via your kidney through the bladder and then you pass it as urine. So don't ever joke with water. Water. Elderly people, why they fall to this is that at old age, most often they forget to drink water. So it's up to the people that care for them to remind them to take water. Otherwise, they will come down with this condition. So reducing salt containing food is also another way to improve your kidney. You have to reduce salt intake. Improving your fruits and vegetable consumption, not peculiar to kidney alone, but to all your organs, is very, very important. But the one that is peculiar to kidneys, drop down the level of salt intake, then take enough water. A normal physiological man is supposed to take at least 3 liters of water in a day. So at least.
Really?
Yeah, let me go on.
Mana doctor, I don't know approach sometimes.
Yes, I was about to ask.
On going with an end wine.
Well, alcohol,
Especially Peter cyanide.
Yeah. They generally contribute to what we are talking about.
Oh, hallelujah.
But most importantly, you have to, at end of it, take enough water.
Yeah.
At least those deposits will be driving out of the system to a reasonable extent. And, our control system is not quite good, so you cannot attest to some of the contents of those things you are taking.
Yeah.
So one should be moderate in consuming such things, even if it doesn't affect the kidney much. Remember, there are also other organs like the liver that the alcohol can damage. So on the general health, limiting alcohol intake will definitely improve your health.
Okay.
So you have talked about conveying toxins, or you call it waste from the system. So, but what I want to ask is, can you expatiate, talk more about how kidney failure stops or reduces the ability of the body to convey or discharge toxins from the body?
Okay. The kidney has something we call glomerulus. Then this glomerulus, in a layman, just see it as a sieve. If you have seen it where it's drawn, it looks like a sieve. So is that sieve that helps in selecting the nutrients. The ones that passes through it is the one the body doesn't need. The one that remains is the one the body needs. You see, so after all circulation, the body, the blood has been used in other part of the body for activities, for strength and all that. They will all pass through the kidney to sieve those wastes through that glomerulus in your. So when they are sieved now, then at the level of the kidney, it will sieve them. Then there is a pipe that connects the kidney to the bladder called ureter. From the bladder, when they are filled up, when the fluid is enough, you now feel like urinating. Then there is also another pipe that connects the bladder to the outside called urethra. So you can imagine when that sieving process,
Yes.
there is no fluid to carry out to transport that waste from that points
One
I've
channel.
mentioned. You see that they may begin to deposit in that inyo, and
It
that
will continue to accumulate.
yeah, they will continue to accumulate. And some of them, when they crystallize, when they form stone, they can come
Solidify.
together over time and form what we call kidney
Kidney
stone.
stone. Wow.
Do you understand? And because of that, the kidney, the stones may also block that pipe linking the kidney to the bladder. You see that the carriage will also be decreased.
Yes.
If it affects one kidney, it may just channel all the work to the other kidney.
Yes.
And if it's not dictated on time, that side of the kidney could just got damaged. So if you are lucky, the other one may still be functioning. But you know how the body works is that if one side of the kidney is sick over time and nothing is done, the other one may overwork itself.
Yes.
And before you could know it, two of them have already gone bad. So
Okay.
that is the transportation. So that's why we're encouraging people to take fluid so that there will be no stasis along this pipe, so that there will be no delay, you know. And if you have any kidney infection or urinary tract infection, you treat it properly, because all these things could cause the accumulation of those waste in the kidney, you know. Other things is that some of these may begin to make pores in your, something like high blood pressure could perforate those in your, because the inyo is just is very, very tiny. So pressure more than what is supposed to carry could tear the net. So those molecules that are ordinarily not supposed to pass will begin to pass.
Okay.
That's why they ask you to do urinalysis. We begin to notice proteins, blood cells. These are not supposed to pass through the urine. It will begin to give us an idea that this person has started having kidney problem.
Okay.
Yeah.
Okay.
Wait.
Wow. I very much at biology, but
This one is beyond secondary school.
Advanced one.
okay.
Is there any available treatment at the earlier stage of kidney failure? Dialysis.
They notice say ozugbo.
Sure. There are. It's just because of our attitude to health care. The challenge we have here is attitude to health care, because at that early onset you are talking about, the person will not present in the hospital. He will be somewhere in the chemist shop and other alternative medicine. So that is usually the challenge. For instance, like I said, this kidney failure, it could be immediate or long-standing one, which we call acute kidney injury or chronic kidney injury. So, and somebody may just lose a lot of blood. When you lose a lot of blood, the kidney will go into shock. Those in your will shrink.
Okay.
Because it's no longer being hydrated properly. So if one could come at that level of shock, it's just to rehydrate, stop the source of loss of blood or fluid, then correct rehydrate,
yes.
and the kidney will return back to normal. Somebody may have burn injury, extensive burn injury, and through those injury sites we'll be losing a lot of, the work of this skin is to prevent us from losing a lot of fluid.
Yes.
So if you have burnt in your body, the person is exposed to losing a lot of fluid, and that alone could cause kidney damage because the fluid level in the body will go down and those in your will shrink and the person can no longer excrete, the medium to transport those wastes will not be there, and all that to start accumulating. What you don't notice, the person can no longer make urine. So it does to rehydrate, then prevent those source of leakages, and the person will be fine. But the challenge is, will the person present that early enough when intervention can be possible? Other ways is the kidney could go down just because somebody has high blood pressure. Do you understand? So we'll notice that the kidney is shutting down. It's simple. Treat the hypertension properly, then the blood pressure will go down. The normal pressure will start coming to the ear, and the kidneys return back to normal. There are other drugs which, when the kidney is about to shut down, you give enough fluid, challenge the kidney with the drug, the place will open again, the person will start thinking. These are early things, treatments that can be done. If the person has diabetes that is making deposit in the kidney, you control the diabetes, the kidney will restore its function and start working again.
Okay, Doc. Talking about early treatment, when you were talking about the symptoms, you made mention of the ankle becoming swollen.
Yes. No.
Because some persons might liken it to ukwabashu.
No.
So it's quite different.
Yeah.
Okay. Because enwere ike ụdịka ahụ mere mmadụ now, instead of the person he meet a medical doctor or na-atọ mmanya ọgwụ, the person will now exactly and the matter becomes worsened. So okay, so since you have said that they are not the same thing, it's a clear difference. Okay.
Like I said before, even though kidney problem present with swelling of the limbs, the legs, there are other disease conditions that also present in the same manner.
Okay.
So there are other things we could put together to really type down which is which. Kidney problem, you notice that early hour of the morning, the person will have puffiness on the face that will begin to clear as the day breaks. So these are other things we will tie together. And it doesn't happen in Okwabashu, and it doesn't happen
now.
Even liver problem, heart problem, kidney problem, all of them present in the swelling of the body and swelling of the legs. So, but there are other ways through laboratory and other clinical findings, you could differentiate the two.
Okay, so let's go into the hope. Madam Buchi, is there any question you have?
Okay, the question I have there is, when it comes to kidney, it's a very expensive thing.
Yeah.
It's an expensive issue. Not a lot of families can take care of their loved one whose kidney has failed. You are into the system, and if there are things maybe by organizations or by the government, I believe you would know. Are there support system for people living with kidney failure, whereby help can be rendered, support can be rendered to them through NGOs, governments, and maybe hospitals?
Like Enyemeka for the common man.
Enyemeka for the common man.
That's not actually the big man.
Now.
Yeah, efforts are being made basically through individual efforts. Like I said earlier, what people do these days is to post the patient online. Their relations get permission from the relation. Some of the media teams will post the patient online and start soliciting for form for the patient. I think I've seen it a couple of times and it's quite effective. Then NGOs, some states have NGOs that also assist. I think now somebody donated a dialysis center at Shanahan that
Okay.
have, I think some sections are free, then subsequently you pay at a low cost. So
Okay.
these are some of the ones I know.
All
Maybe there
right.
may be other ones, but
All
the
right.
ones I know is the one I can see.
Okay,
Thank you very
thank
much.
you so much. Thank you so much, Doc. We really appreciate you for the time. So, in the buying, people have heard all that Doc has said today. So, what it means is that we should be drinking water because it's not about 3 liters.
Thank you for it.
It's about how many
At
liters?
least,
At least 3 liters.
At least 3 liters in a day.
especially in the hot
Okay.
weather.
Because
Okay.
when you have Jamoshan.
Yes.
Yeah, more coach.
So please, let's drink a lot of water to help your kidney to avoid failure. Baka no board and the jego. Metandi jego sometimes. Ana akrote kokodino dialysis la. So even sometimes you see posts on the social media, people are begging for funds. Before they can realize that amount needed, the person might have died. So please, the most important thing, even if you did not learn anything today, you should learn is drinking of water. Don't joke with water. Water is life. We have been saying this, we have been hearing it, that water is life. And if you have not been taking water serious all this while, please start taking it serious. So please, before we end this program, we would like you to do one thing for us, which is that you should like our program or our post on Facebook, comment and also share. And if you have not followed, please make sure you follow us at BMTV Nsukka on Facebook. Also, make sure that you subscribe to our YouTube channel at BMTV Nsukka. Thank you so much. We really appreciate you. Bye.
Thank you.
With BMTV, the future's bright and